It's the NAPT Dobson DaVanzo survey, and it's a survey of men who've had prostate cancer who've also received proton therapy. What was really exciting about it was we had a good cohort of men in each time period since their therapy. So we had the under 6 months, the 1 to 3 years, 4 to 5. We had 10 plus years. We had several hundred men that were 10 plus years from the therapy. So we were able to talk to the immediate side effects or the immediate effects of proton therapy, the mid-range, 5 years out where it's not the center of your life anymore, and then the more deferred after 10 years. And that's what's so important, because there are very few studies that have that kind of a time frame or that kind of distribution of patients. The survey talks about what we call health-related quality of life, and it's in 3 areas. It's in bladder function, bowel function, and sexual function, because these are the 3 areas that men have trouble with who receive any kind of therapy for prostate cancer. And a high score is positive. That's your most positive. It ranges from 1 to 100. And it has a number of different questions about each of the functions that give you a 3-dimensional picture of quality of life. This year we introduced some additional variables, because what the health-related quality of life is, that's an outcome, but it's less tangible than something like cost or recurrence or side effects. All these things are very tangible and measurable. The survey is remarkable because for the first time we're not talking about sort of a self-reported quality of health. We're talking about a tangible occurrence of non-recurrence of cancer. And that has, tremendous ramifications. What distinguishes proton therapy is that the physician can direct the beam directly to the tumor. You just want to kill the tumor. You don't want to kill all the surrounding tissue. And that's what makes proton therapy so special. The findings are so consistent. So last year we had 2,000 respondents. 98%, 99% said this therapy was the best choice for themselves. They would recommend it to others. So what we're trying to get is a very 3-dimensional picture of what's a man's life like after proton therapy, and why would you choose proton therapy? And a lot of our respondents said they did not want the side effects of all the other treatments. And prostate cancer has a lot of different treatments to choose from, but they all have side effects. The reason they chose proton was to avoid those side effects and to have, a normal life.